On Fox tonight, across the country, we're seeing more warnings from state health departments and poison control centers about ivermectin. People are using that drug intended to kill parasitic worms to treat or prevent COVID-19.
In fact, last night we brought you a warning from the Oregon Poison Center to not take this drug for COVID-19. Fox 12's Camilla Ortiz joins us live with where Oregon stands in all of this. Camilla?
Well, local pharmacists tell me ivermectin is like the new hydroxychloroquine. People are buzzing about it. They're asking local pharmacists and doctors about it, and they're actually getting prescriptions for it for COVID-19. This despite warnings from the FDA and the CDC that it's not been proven to work against the virus and its side effects could be dangerous. The Oregon Poison Center sounding the alarm about the drug ivermectin.
People can develop symptoms like diarrhea or vomiting, but also more severe symptoms like low blood pressure, coma, and seizures.
Dr. Robert Hendrickson says the Poison Center has managed 3 times more cases of people misusing the anti-parasitic drug in the month of August, 9 so far, than they did in all of 2020 when they had 3 cases. Oregon isn't alone. The spike in misuse nationwide coming from studies and unfinished trials circulating online that claim ivermectin could help cure or prevent COVID-19. It's actually designed to treat intestinal parasites in both people and livestock.
What we're concerned about is that people might be taking this without their physician's advice, that they might be taking the wrong dose, and that may lead to severe toxicity.
Turns out Oregon physicians are prescribing it. A viewer sent us this email blast from a medical clinic in Salem that says they've been getting over 100 emails a day about ivermectin, and that, quote, in order to receive a prescription for ivermectin, the doctor is required to have a risk versus benefit conversation with you. I called the medical clinic, but they didn't want to comment. Most pharmacists I called didn't want to either.
We're kind of in a gray area, but we got to be careful.
Wade Irby with Beaverton Pharmacy said he's been getting lots of inquiries lately about ivermectin, telling me the Oregon Board of Pharmacy sent out a warning earlier this month that the drug has not yet been proven safe and effective against COVID, but also that pharmacists should use their professional judgment on whether or not to fill scripts.
We can just flat out refuse it. I mean, that's within our power to do it. But typically what happens is we'll communicate with the prescriber about it, let them know what's going on, what we've discovered.
Irby told me they do have ivermectin on the way to the pharmacy and that he's not above filling a prescription on a case-by-case basis despite the federal and state warnings.
There's quite a bit of information out there exploring these things.
Another pharmacist I talked to said he's not filling any prescriptions unless the drug is to be used for its intended purpose. Perhaps a bigger problem, doctors said they know people are taking the animal version of this drug, which you can find at feed stores. Every pharmacist I talked to today said that is even more dangerous because the animal product is highly concentrated, meaning it's easier for people to overdose. Reporting live tonight in Beaverton, Camilla Ortiz, Fox 12 Oregon.